Knock, knock. Hi, my name's Casey. I'm going to be your nurse today. Hand hygiene. So, can I see your wristband, please? Very good. Can you tell me your full name?
Selena Pierce Harris.
Wonderful. And your date of birth?
9/24/1994.
Awesome. So today I'm going to be doing an assessment on your abdomen. I'm also going to be assessing your musculoskeletal system. So it's going to take about 10-15 minutes. So if you have any questions for me, just let me know.
Okay.
Or if you feel uncomfortable at any time.
Okay.
So any questions?
No.
Okay. So the patient understands the procedure and what's going to be going down. Before we get started, can you please empty your bladder?
Okay, I already went.
Okay. And can you put this gown on?
Okay, great.
Awesome. Just tie it in the bun.
Okay.
All right. Are you comfortable?
Yes.
How is everything with the lighting, the temperature?
Everything is great. I'm very comfortable.
Okay, very good. So I'm going to ask you a few questions.
Okay.
When was the last time you had a bowel movement?
This morning.
Okay. And are you pretty regular with your bowel movements?
Yes.
Okay. Can you describe the color and consistency?
Pretty normal, brown and soft.
Okay, very good, very good. Any nausea, vomiting?
No.
Okay. Any pain or tenderness?
No.
Okay. And have you had any burning or frequency, urgency with urination?
No.
Okay. Any strange colors, odors?
No.
Okay. And are you pretty regular with your voidings?
Yes.
All right, very good. So I'm going to go ahead and assess your stomach now. So if you can, sit down on the bed for me. Very good. All right, so I'm going to lift up your shirt and take a look here. All right, so it looks like the umbilicus is centrally located. Her skin color is normal for ethnicity. She has no skin abnormalities, no moles or anything like that. There's no redness. Yeah, all right. So I'm going to go ahead and take a listen here. All right. All right, bowel sounds are present and normoactive in all 4 quadrants. So I'm going to go ahead and auscultate for bruits now. Alrighty, no bruits were auscultated. So I'm going to go ahead and I'm going to palpate your stomach and just let me know if you feel any pain or tenderness.
Okay.
Alright. Sorry, my hands are cold.
It's okay.
Any pain, tenderness?
No.
Alright, so the patient reports no pain, but if she did, I would use Old Cart's ice to assess further. So that concludes our elimination assessment. So I'm going to go ahead and I'm going to assess your mobility now.
Okay.
So I'm going to ask you a few questions. You can sit on up for me.
Okay.
So have you noticed any issues just moving about?
No.
Okay. And have you noticed any weakness in your muscles?
No.
Okay. How about issues performing normal activities?
No.
Okay, and have you noticed any pain or tenderness?
No.
Okay, very good. So I'm gonna have you stand up.
Okay.
I'm just gonna take a look at you. I'm gonna stand over
this
here.
way?
Yeah. Okay, so the patient is standing erect. Her knees are in line with her hips and her ankles. She is maintaining balance on her own. So now I'm just gonna assess your spine. The spine is straight. There's normal curvature in the cervical, thoracic, and lumbar spine. There's no deviations in the spinal column. Extremities are all equal and bilaterally proportionate. So I'm going to go ahead and I'm going to palpate down your spine. Just let me know if you feel any pain or tenderness.
Okay.
Any pain?
Nope.
All right, so the patient reports no pain. If she did, I would further assess with Old Cart's ice. So I'm going to have you go through a few range of motion exercises. So if you can, bend forward for me and touch your toes. Awesome, very good. Stand up for me. Awesome, and if you can, now bend backwards. Very good, yes. And now bend to the right. Very good, and then bend to the left. Wonderful, and if you can, rotate your body towards me to the right. Very good, and rotate towards me to the left. Very good. Any pain when you were doing those exercises?
No pain.
All right, very good. So range of motion is all normal, and she has no pain when she is doing those exercises. So you can go ahead and sit down for me again.
Okay.
Wherever you would like. So I'm going to go ahead and take a look at your hands. All right, the hands are not atrophied in any way. There's no tremor, no shaking, and they look all even and symmetrical. Skin is warm, there's no swelling, no edema. So I'm going to go ahead and palpate your shoulders and your arms. All right, any pain at all?
No.
All right, so there's no redness, no swelling, temperature is normal, within limits for muscle tone. So now I am going to ask you to put your hands up for me like this.
Okay.
Okay, I'm going to put some resistance here, so just pull on me.
Okay.
Very good. So bicep strength is a 5 out of 5, and no pain was noted at all?
No.
All right, very good. So go ahead and face them out. Same thing, resistance. Awesome. Any pain?
Nope.
Okay, no pain noted. 5 out of 5 strength for the triceps. You can go ahead and put your arms down. So I'm going to palpate your legs. Okay, no swelling, no redness, no edema. Any pain?
No.
Awesome, very good. So I am going to ask you to curl your legs in towards you. Very good. 5 out of 5 strength for her hamstrings, and there's no pain.
No.
Awesome, very good. So I'm going to go ahead and ask you to push out.
Oh, that's a tricky one.
Oh, that is a tricky one. There you go. No pain?
No pain.
All right, no pain and 5 out of 5 strength for her quads. And that concludes our lovely little assessment. The end. Oh my goodness.